Springs.
Nearly 500,000 people.
Olympic City, USA.
Garden of the Gods.
Pikes Peak.
It's a growing city.
Our local government has a lot of employees. What exactly do they do?
How does it impact my life?
This is where you find out.
Behind the Springs, an inside look at your local government.
Hello, everyone. I'm Jen Schrader, and I want to welcome you to Behind the Springs, a look at your local government. And these days, it also means a look at public health in our community. And one of the latest pandemic topics of conversation is the approval of that COVID-19 vaccine for kids ages 12 to 15. And just like when the vaccine became available to adults, there are many questions out there. And just like anything that has to do with your health, it is always best to hear from the experts. So I'm very happy to welcome the Chief Medical Officer at Children's Hospital Colorado, Dr. Michael DeStefano. And Dr. DeStefano, I just want to thank you so much for your time with us today.
Well, I'm happy to be here. Thank you for having me.
Can you start by telling us a little bit about yourself and your role with Children's Hospital Colorado? Perhaps a little bit about why you came to be in the career that you are.
Sure. I'm a pediatric emergency medicine physician, and I was a Houstonian until I married a Coloradan. I met her in medical school. So we sort of transitioned my career up into the Denver metro market, and I've always been involved in quality and patient safety. And subsequently, it melded into administration. And so in 2019, I had the opportunity to come down to Colorado Springs, which is actually where my wife is from, to open up our hospital. And so that's sort of my journey into administration. I still do shifts in the emergency room, so I am still clinically grounded in the ER, but I, as my kids say, I do a lot of email and meetings, and that's my job. I don't take care of patients as much anymore.
Right, but nice to have the combination, I would assume.
Yes, it is. It's a nice little break on both sides. So it's always I got into medicine to help patients. My helping patients just takes a different perspective now, meaning it's a little bit broader outside of the emergency department. But it's always nice to go back to the ER and sort of have those patient-facing and relationships that inspired me to get into medicine in the first place.
That's for sure. Well, let's go over right now what we know when it comes to the recommendations about vaccines and our youth. What exactly has been approved?
So right now, the Pfizer vaccine is approved for 12 plus. So anyone who's 12 years of age and older can receive the Pfizer vaccine. And that was, that just got approved in the beginning of the month of May. So we are new along this journey of vaccinating our youth.
Okay, and I know there are real concerns, obviously, about vaccines in general, but in some cases, even more questions and worry giving the vaccine to our kids. I'm a parent. I know how that goes. We're always worried when it comes to making those decisions for our children. So what kind of questions are you receiving and are you hearing out there?
I think there's a lot of, unfortunately, some misinformation out there. I'm a parent as well. And so I think it's one thing to give yourself the vaccine because you are consciously making that decision. It's another decision, somewhat more challenging to give it to your own child who is growing and developing. So there has been, I think where people start to pause is that kids are different, and I'm in the business of difference, meaning that kids aren't little adults, but there's nothing magical that happens between the age of, it was originally 16, right? There's nothing magical that happens between 15 and 16, but because of the way science is set up and the way we evaluate whether it's drugs or vaccines, we want to be very intentional in ensuring that the safety profile is for all of the age ranges. And so that's why we sort of break it up and say, okay, it's safe for adults. Let's start then decreasing the age range and look at safety and efficacy. And what we know from the data from Pfizer is it's extremely safe and extremely effective. So when you look at their study, there were no kids who actually received the vaccine 12 to 15 who actually developed COVID. And I think that's, I always go back to the science and making sure we can't be in anything 100% certain with side effects, right? Especially when you start applying it to a very large population. We take samples of a patient population so that we can extrapolate to the larger population. But as you start vaccinating millions of individuals, you're going to end up seeing some of these side effects. There's a couple of them that I'll like to speak to, one of which is around sterility. I think we've heard a little bit of that around some social media, that the vaccine, specifically the mRNA vaccine, so Moderna and Pfizer, can cause sterility. And where that had come from, there was this report that was not out of that wasn't based in science, but there was a report that the spike proteins that the mRNA vaccine, those spike proteins are in that vaccine, and that's how you become immune. So those spike proteins sit all on the outside of the coronavirus. So when you get the Pfizer vaccine and the Moderna vaccine, you're not actually getting a coronavirus. You're just getting these spike proteins that allow your body to recognize it. And there were some concerns that those spike proteins were very similar to the ones in the reproductive tract, and so that there would cause some sterility. There's no evidence. In fact, those spike proteins are totally different. We haven't seen that. So that's one of the ones that I've heard.
That's a big one, I think. Yeah. And like you said, it is. I was curious about the origin of it myself. So it was social media based. It wasn't coming from any medical source.
No, and I think that there's always good intent. Usually there's good intent. And I think there is some similarities in the spike proteins, but they have to be exact to cause a response, essentially. So, it was something that I took in and looked at and said, I trust the vaccine. So I have 3 kids, 2 of which that qualified in this age group, 12 to 15, and I vaccinated them. The other, I guess what we're hearing a little bit more now is there's a report about myocarditis, and what myocarditis is inflammation of the heart. And this was specifically around the Pfizer vaccine. And what the CDC has said is that there are relatively few reported cases of myocarditis. It's usually seen after the second dose and about 4 days after the vaccination. Those numbers were very similar to what you would see in the general population. So in the general population, 10 to 20 out of 100,000 people will get this condition called myocarditis, and it's usually caused by a virus. Okay, and there's many viruses that end up causing it. And so what we know right now is that there is a little bit, there is some myocarditis in patients who have received the vaccine, but we don't know if it's causality. From what I can tell from the data, it looks like this is just sort of what's in the community. In fact, coronavirus actually causes myocarditis, but it is secondary to the viral infection of the heart muscle. So it's not the body's response to it. So that, it's important that we report these instances. So I go back to the J&J and that we're having some clotting issues. We want our physicians, we want our population to make informed decisions and have the information at hand. I think what's going to end up happening from this myocarditis is that it's going to be, well, this is what's baseline in the community. There is no causation from the vaccine. From what I know and what the CDC had put out there, the cases have been very mild, and that they essentially are being treated as outpatient and they resolve or have resolved. So it's something to keep an eye on. I'm not overly concerned as a physician or a parent who has vaccinated their children. For each of us, we have to weigh risks and benefits, right? And I think fortunately with kids, COVID infection has not been as severe as in adults. But I think where we have sort of lost the message and understanding is it doesn't mean it doesn't affect kids, and it doesn't affect them in ways that is very impactful. So to give perspective, it is now one of the top 10 causes of death for kids, COVID is. And that is with the infection. There is also, and there was a lot of reports initially as New York sort of increased their numbers of cases of what we call the multi-system inflammatory syndrome, the MISC. And that is somewhat severe. And we've had to take care of kids in the intensive care unit that have had this post-inflammatory process after COVID. And so while it is not as severe as adults, it has been impactful for kids. And from a public health perspective, it is so very important that we vaccinate our children so that we get to a point of herd immunity and hopefully put coronavirus and this coronavirus behind us and sort of get back to life as normal.
Well, I think you make a great point on the risk versus benefits, because that's what I'm hearing a lot from people is we're sold on older people getting this vaccine because we've seen them die. We've seen these very serious consequences, these long haulers, et cetera, but we just haven't been hearing that about kids. So there's not this there's not the feeling of urgency, perhaps, that we felt when we wanted our, older relatives to get vaccinated, or even middle-aged people, or, younger adults, even. But with kids, we've heard so little about the seriousness of it. I think that people are a little more, I don't even want to say hesitant, more relaxed almost about it. And there's not that urgency.
Yeah, the narrative for coronavirus was definitely our kids fared better, but that didn't mean that they weren't impacted. And I think the stories subsequently sort of dwarfed what was happening in the pediatric population. We didn't have hospital filled with coronavirus patients, meaning that we weren't like our adult colleagues that were shuffling patients around to manage that influx. But we were taking care of kids who, some of them mild, some of them very severe illnesses within coronavirus. I mean, it speaks to the fact that, it's a top 10, unfortunately, reason for kids to die currently is through coronavirus infection.
And so at this point, how do you feel, since we're talking a little bit about folks making that decision, how are we doing on vaccinating our youth? Where are we now? Where do we need to be?
It'll be interesting as we see data that comes out. I think we're too early in this process to understand. What we have seen is the older population definitely have been vaccinated the most. And as you kind of drift to those younger age populations, we haven't seen a vaccination rate like the older population. And that sort of makes sense because from a personal risk, it's a little bit less, right? Meaning that, I think that there were at times when, if you had gotten coronavirus and you're 80 plus, you were in double digits risks of having dying, especially very early in the disease. So that definitely, I think, affects how people view the vaccination, right? Their own personal risk. As we go into the younger age groups, we're going to probably see a uptake that is not as what we probably need it from a community perspective. I can tell you that we started vaccinating kids on May 19th here locally in Colorado Springs, and we've had a couple of vaccination clinics. So we're a little bit unusual. We don't have it daily. We have certain days of the week that we vaccinate, and we've vaccinated about 450 kids. So we've had about 3 clinics, 450 of the 12 to 15 age range. We've vaccinated other individuals during those clinics, but about 450. And I was actually pleasantly surprised with it. I know that as we had our vaccine clinics, we have watched our numbers sort of drift down as we've progressed with the vaccination effort. And when we opened up to this younger age population, there was a increased demand, and so we had to open up some more vaccination clinics. So I was pleasantly encouraged, but as if I had a crystal ball, I think it's going to be a challenge to one, convince parents to vaccinate their kids. My sister, who got the vaccine, is still pretty hesitant on getting her children the vaccine. I think it's one where she's the way she explains it is that, I probably will vaccinate them, but I'm not going to be first in line. And so
I'm with your sister a little bit. Yeah.
Yeah. And I think,
I have to admit.
that's an okay way to look at it. And
Mhm.
there is no judgment here. We each have to deal with sort of the decisions. For me, my decisions to vaccinate my kids really, was one for their own safety, but it was also for we have some high risk individuals who are around as well. And while the vaccination is very effective, we know that there's a small number that still get infected. And so we made that choice because of sort of who they are around, grandparents.
You're right. Everyone has their own situation, but that leads us into my final point that I really want to make. And we've talked about it all along about the importance of getting accurate and reliable information during the pandemic. And same goes for this situation. When you're considering this, if you have young people in your lives and you're, deciding whether or not to vaccinate, it's really important to not get your information from Twitter and, or Facebook, and really go to those great websites. And I know childrenscolorado.org is where people can go for your clinics and your information. El Paso County Health.org is a great one in the Colorado Springs area for reliable information, just facts and some things that people can go through more in depth, perhaps if they're still on the fence about it.
Yeah, I cannot stress the importance of not going to social media. And if you do get your news source from social media, and you should probably do some other research. I do want to stress, I think because of people's expectations of physicians and healthcare and our healthcare leaders like the CDC, there were a lot, especially in the beginning, and this was no different for us in the hospital. We were changing day by day, week by week, because they described it at the very beginning, the novel coronavirus, and novel means new. And the way we look at it from a science perspective, we can make some judgment calls on whether the virus is going to act like a typical coronavirus, but we had no idea what was happening. In fact, a lot of the things that we have seen in pediatrics, like MIS-C and some of those other events, is not necessarily described with any other virus. And so there was a lot of changing of what people were saying, and that is totally normal. As you get data and information, some of those assumptions you learn are wrong and you need to pivot. And so I do want to stress that those websites like the CDC is a trusted website and trusted individuals for me as a physician and as a healthcare leader. And realize that pivoting in the very beginning was not necessarily that they were withholding facts. They just didn't know the entire truth of the coronavirus. Even how they treat our most critically ill patients is different than other viruses. And so there was a lot of learning that was going on. There was a lot of, they didn't understand how it was being transmitted. So there, I go back to some of the masking issues. Well, they didn't know what we know now. And so once they figured it out, they said, okay, we need to pivot. We need to message differently. And I think that has done some disservice to some of those organizations. So, I still trust the CDC. I go to their website actually very frequently to get information. You mentioned our own website as well. And you can, if you just type in Children's Hospital Colorado.org, you can drive to our COVID page, which has frequently asked questions, and it will have the latest and greatest, including on the Pfizer vaccine. And then on top of that, I always point people back to their pediatricians, right? There's a relationship there, or their family practice physicians, so that, you can have a dialogue. It's always hard to get information, and it's very a one-sided conversation. You read it, you may internally digest it, but have a conversation with your healthcare provider. Let them know your concerns and talk through it. It's so very important that we not only get the correct information, but we're able to digest it in a way that you can make a decision.
Those are some great points, and it's interesting, but I have a friend who's in the medical field who works for Memorial Hospital, actually, who was saying throughout the pandemic, we just are very impatient as a country, as a people in general. So when things were changing and we didn't have the exact answers, there was just this feeling of why don't you know it all right away? And like you said, I think it's wonderful to point out it was a novel virus. It was new to everyone. And so same with these vaccines, we have to have a little patience as we get through this brand new situation, everyone together.
Yeah, I do want to stress that the mRNA vaccines they've been working on these for many, many years. And why medicine takes a long time from idea to production is that there are definitely steps that have to occur. Those steps have been done in serial. So there was gaps between like phase 1, phase 2, phase 3. This mRNA vaccine that we are seeing with Pfizer and Moderna, it was expedited, and it wasn't expedited in a way that decreased the safety of it, but they actually did things in parallel, which was very new to the medical industry. Usually there is a lot of gaps in between, and you do it very serially because there isn't a time push to get it out to the public.
But this time there was, right?
Yeah,
and this time there was.
And we knew that we had to, if we were going to affect sort of where we were within the pandemic. I always go back to, people say, well, it wasn't that bad. We didn't have, there wasn't all the deaths that you would see with the Spanish flu or some of those other comparable events. But what we did was we shut down our economy. We really isolated, and I can tell you that our adult colleagues were at breaking points at many different steps throughout this pandemic. And if we wouldn't have put up some of those things that we did from a public health perspective, we would have overloaded our system, and we wouldn't have been able to. Our healthcare system isn't meant to take care of these huge surges of really critically ill patients. So we would have been in dire straits.
Are you feeling hopeful at this point? How are you feeling?
I am sort of, we in the United States are in a very different place than some of our colleagues around the world. You can look at our numbers as a country, and all of our indicators are going down. Our positivity rate's going down, our deaths are going down, our hospitalizations are going down. So very, very positive. One of the concerns is that these viruses mutate. And while they have been effective for the mutations, and we think the variant in India, it is still effective. My worry is that there's going to be a variant that's going to pivot a bit outside of the vaccine. And the nice part is that we have the vaccines, and I think we can make adjustments pretty quickly versus where we were a year ago. But that's where I get concerned, because the more, as you have this virus circulating, it will continue to mutate, and it's sort of a race to get to herd immunity and decrease the mutation rate of the virus. Once we get to that herd immunity, the mutation rate decreases because there's just not as many patients or individuals infected with the virus. So I am cautiously optimistic, and I look forward to the coming months, and hopefully we continue along this trajectory, and we're able to vaccinate those individuals and the individuals around the nation, because this is not just around the United States, but if India can't get vaccinated, or if Japan can't get vaccinated, or other countries can't get vaccinated, there's still a risk to us in the United States, because as those variants populate, there's a risk that they may be resistant to the vaccine may not be as effective.
Right. Good points. Okay, well, this is great. I really appreciate you going over this information with us. It's a nice back and forth and conversation, and I appreciate you letting me pick your brain and ask you all these questions. It's really important decisions for people. So we appreciate your time. We're fortunate to have Children's Hospital Colorado in our community. We're so grateful to hear from you, and maybe we'll be able to talk again and update as we go along here with the vaccine process.
I would love to, and would be happy to have a conversation again.
Okay, thank you so much, and thank you everyone for listening to Behind the Springs.